Hi, this video is about my personal experience choosing therapy for multiple sclerosis. I want to say right away, there are no medical recommendations here, this is just my personal experience. Maybe in a different situation I would have chosen another medication, or my decisions might have been completely different. I'll tell you what influenced my choice, which medications I considered, and why I ultimately decided on this particular therapy. After my relapse was treated, the question immediately arose, how should I continue my treatment? Naturally, my first step was to go online and start Googling questions like how to treat multiple sclerosis. The search results were, to put it mildly, pessimistic. After reading a lot of articles from various sources, patients, professors and doctors who treat multiple sclerosis, there was a consistent recommendation everywhere. Start therapy as early as possible. I took this question to the hospital and they told me that there are currently no government programs for treating multiple sclerosis in Ukraine. Yes, I currently live in Ukraine, but I was offered to participate in a study with an experimental drug. After reading about this drug, it turned out to be quite effective and has very good indicators and results. But as always, there was one but. The probability of receiving the drug with the active ingredient was 50%. That is, there was a 50% chance I would get a placebo and a 50% chance I would get the actual drug. And naturally, I refused, since the recommendation is to start as early as possible. And if I ended up with the placebo, I wouldn't be receiving any treatment for at least a year. After that, I decided to dig deeper. Since there was no comprehensive information available anywhere to study everything in detail, I downloaded the official treatment protocol with all the recommendations, and all the medications show people with multiple sclerosis are actually treated. Only after that did I go to various multiple sclerosis specialists. In total, I consulted with 3 doctors. And I also recommend to you, if you don't understand a certain topic, it doesn't have to be an illness talk to or consult with several specialists, and then you'll get the most complete and accurate information. That's exactly what I did. After studying and analyzing all this information, I realized that I needed to start therapy with the most effective medications. Currently, the 3 most effective medications available in Ukraine are Rituximab, Ofatumumab, and Ocrelizumab. I decided to use the process of elimination. The first drug I ruled out was Rituximab. Yes, it has the most attractive price, if you can call it that. The cost of treatment with this medication is about $2,000 per year. But at the time I was choosing my therapy, this medication had not yet been officially approved as a treatment for multiple sclerosis, and it contains a fully chimeric antibody. In other words, the likelihood of the body rejecting this medication is higher than with the others. Accordingly, I decided against it. The second medication I ruled out was Ocrelizumab. This medication is considered the most effective, but it also has the highest price, about $10,000 per year. Another downside, specifically in my situation, is that since I live in Ukraine, the situation here can change at any day, any week, or any minute. Ocrelizumab must be administered intravenously in a hospital using special equipment once every 6 months. In my situation, this is a significant drawback because something could change and I might lose access to the hospital. That's why I also decided against this medication. I ended up choosing Ofatumumab. The advantage of this medication is that it contains a fully human antibody. Accordingly, the likelihood of rejection is minimal. Another advantage in my situation is that I can administer the injections myself. It is given subcutaneously. This injection needs to be done once a month. The annual cost of this therapy is about $8,000. That was my process for choosing a therapy. Maybe it will help you. Although, let me remind you, this is not an instruction manual. If you found this video interesting, please like, subscribe to the channel, and share your experience choosing therapy in the comment. Let us know which country you're in and how things are going for you. I think it will be interesting for me as well as for others who watch this video. Wishing everyone remission in life. Bye.